All right, good afternoon. Thank you for joining us for today's briefing. I want to start first by welcoming the Erie County Executive, Mark Polankars. I'm also joined here in my Monroe County Health Director, Dr. Michael Mendoza, and by the Chief Medical Officer of the University of Rochester Medical Center, Dr. Michael Apostolakis, and the Chief Medical Officer of the Rochester Regional Healthcare System, Dr. Robert Mayo. And like I said before, we're also joined today by our counterparts in the team in Erie County, who we're so happy to work so closely with as it comes to fighting COVID-19 in our communities. And I want to toss it over to County Executive Mark Polankars to introduce his team that's joined us today from Erie County.
Thank you, County Executive Bello. It is good to be here, though I really wish we weren't, because we have some information that we do need to share with the public that we think is applicable for all of the regions of Western New York and the Finger Lakes. I will be joined, and you will hear from soon, our Health Commissioner, Dr. Gail Burstein. We also have the Chief Medical Officers for the four major hospital systems in our region, Dr. Hans Kassengold, the Executive Vice President and Chief Physician for the Catholic Health System, Dr. Michael Minio, the Chief Medical Officer for Buffalo General Hospital, Millard Fillmore Suburban Hospital, the Kaleida Health System, Dr. Brian Murray, the Chief Medical Officer for the Erie County Medical Center Corporation, and Dr. Stephen Turkovich, the Vice President and Chief Medical Officer for the John R. Oshai Children's Hospital in Buffalo. As I noted, we have some serious information to cover with regards to the rapid growth of COVID-19. And with that, I'm going to turn it back to County Executive Bello to begin the discussion.
Great, thank you, County Executive. And as County Executive Polankars noted, he and I have come together to raise awareness and concern about our rapidly increasing COVID infection rates, and what's more concerning, the corresponding spike in hospitalizations. We both recognize this is a regional problem, and this is a regional call to action for Western New York. While County Executive Polankars will speak to the specifics in Erie County, and I'll speak about Monroe County, the picture we describe is very similar. Today in Monroe County, we're reporting 347 new cases of COVID. Over the weekend on Saturday, we saw a high of 515 new cases. Our 7-day rolling average is 418. Just 1 month ago, we reported 241 cases and a 7-day average of 218. If we go back a year ago, though, on this date, we were at 260 cases and a 7-day average of just 238. Along with our case rates, our community is seeing an increasing number of people hospitalized. Last year at this time in the Finger Lakes region, we had 184 people hospitalized with COVID and 33 in the ICU. Just 1 month ago, we were at 229 hospitalized and 52 patients in the ICU. As of this weekend, we were at 289 people hospitalized and 82 in the ICU. These numbers paint a clear and concerning picture of what's happening. We're yet again seeing an increase in infection rates and hospitalization rates due to a number of causes: the return to school, the new college semester, colder weather, more indoor gatherings, and of course, the Delta variant. These increases are a major concern, and we do not want a repeat of last year, when we saw continued increases, strains on our hospital systems, and restrictions imposed by the state of New York. Now is the time to double down on what we know works, bring down our case numbers and corresponding hospitalizations. What I'm asking our residents to return to vigilance, and here's how, and you'll see this is all common sense. First and foremost, get vaccinated. This is, without question, the most important thing each of us can do to end this pandemic. If it's been 6 months since your Pfizer or Moderna vaccine and you qualify, get your booster shot. If it's been 2 months since you got the one-shot Johnson & Johnson vaccine, get the booster shot. You can make an appointment by visiting our websites. If you have a child between the ages of 5 and 11, now you too can get them vaccinated. The next most important step we can all take is to wear a mask in public indoor locations. Whether you're shopping at the grocery store or gathering with friends, even if you're vaccinated, masking can help stop the spread of infections as an important mitigation tool that has been proven effective. And finally, if you're feeling sick or showing symptoms, stay home, call your doctor, and seek a test to rule out COVID. These are common sense mitigation strategies that worked in the past to bring down our curve and will work again if we all participate. The holidays are upon us. We are 10 days out from Thanksgiving and the kickoff to a time of year when we all want to be spending time with friends and family. We want to be healthy again, so we're able to bring together confidently and safely our loved ones from across generations. The vast majority of people who are going to be quarantined or in isolation on Thanksgiving aren't even sick yet. Think of that. Now is when we double down on strategies to remain healthy, get vaccinated, mask indoors, and stay home if you're sick. Finally, we may be asking why we have increased hospitalizations when more than 70% of our residents are vaccinated. The doctors are going to go into more detail, but here's the stark reality. The clear majority of people hospitalized for COVID are not vaccinated. 8 of 10 people in ICU with COVID are not vaccinated. 9 out of 10 people on ventilators due to COVID are not vaccinated. You have 10 times the risk of being hospitalized if you are not vaccinated. Masking and vigilance will help stem the short-term spike in both infection rates and hospitalizations, but the long-term answer is clear and it's simple. It's vaccination. Get your children vaccinated, vaccinate yourself, and if you are ready for a booster, now is the time to sign up. And now I'll turn it over to County Executive Mark Polankars.
Thank you, County Executive Bello, and I do appreciate your comments because they are exactly the same as mine as it pertains to Erie County and Western New York. If your team can share the first slides that we shared with you earlier today, I'd like to go into the most recent case history in Erie County. This is as of yesterday, and you can see we are in a fourth spike. There is no doubt about it. We had our initial spike at the beginning of last year, the increase last fall, then the drop. And then, of course, we saw a spike again in March and April. We actually are seeing cases and rate totals in most recent days that are higher than what we saw in the spring. That highest line that you see on the screen there was 714 new cases that were reported on the 12th of November. There was a drop the last 2 days, but the positivity rate did not drop. So what we did is we had less people actually getting tested those 2 days, which ended up with less results, but the positivity rate in itself did not drop. If you go to the next screen, the next slide, excuse me, you will see the positivity report for Erie County and how we have seen some spikes. Unfortunately, the most recent day did not make it in time to the slide, but it actually was 9.7% for yesterday. So while we had 369 cases yesterday, the positivity rate was 9.7%, the highest it's been in many, many months. So we are seeing continued growth in cases across our region. And it's quite evident when you go to the next slide, which is cases in the past 7 days per 100,000 residents, you see that line continues to grow. We are over 300 new cases per 100,000 residents, approximately 350 for the last 7 days. And this, unfortunately, also is the same type of trajectory we are seeing with our hospitalizations. Hospitalizations in Erie County have increased significantly in the last week or two. But one of the things I'm hearing from the hospital systems is not just all Erie County residents that are being hospitalized and unfortunately dying, because we have seen quite a number of deaths in our local hospitals associated with COVID-19. If you go to the next slide, this is a breakdown as reported by New York State of the Finger Lakes and Western New York regions as it pertains to case rates on a daily basis, as well as a 7-day period for all of the counties in what would be considered Western New York and the Finger Lakes. And unfortunately, some of the counties with the highest case rates and positivity rates are the counties in between Erie and Monroe County, like Orleans, Genesee, Wyoming, or in our southern tier, Cattaraugus and Allegheny, which also have correspondingly lower vaccination rates compared to Erie and Monroe counties. I bring this up because I want people to understand this is not a Buffalo or Rochester issue. This is an issue for all of Western New York and the Finger Lakes. And actually the case rates and new case rates over a 7-day period are actually worse in areas where you would normally think they would be better, because you would actually have a less dense population living in Orleans and Genesee and Wyoming, Cattaraugus, Allegheny counties. There's less people living there, and there's less people living there per square mile by a lot compared to Erie and Monroe. And we want people to understand that the cases that we're seeing are not just urban cases or suburban cases, they're also rural cases. And unfortunately, a number of individuals who died in Erie County hospitals in the last 2 weeks We're not Erie County residents, but we're residents of these other counties. And that's why we think it's very important that this message get out. That number one, if you have not been vaccinated, please get vaccinated, especially those now that we have the opportunity to vaccinate the 5 to 11-year-olds. If you were vaccinated and fully vaccinated more than 6 months ago with the Pfizer or Moderna vaccine, or 2 months with the Johnson & Johnson, get a booster. We'll boost you. No questions asked, as long as you're over the age of 18 and it's been more than 6 months since you got the Pfizer or Moderna completed, or 2 months since the Johnson & Johnson. Truly, we need people when they're in public locations inside where they cannot otherwise safely socially distance to mask. We know that a lot of these cases are resulting from individuals going to private parties and private gatherings in homes. We need you to be careful. And as Dr. Burstein will talk about soon, it's probably smart to know where your status is to get tested beforehand. And we want people to understand that none of us are interested in implementing mandates like we saw in the past. So we're asking our public to please act appropriately. This will protect our community, and it will certainly help our healthcare heroes who've been working almost nonstop for 2 years now. And unfortunately, in Erie County, the hospitalization rates with bed capacity have been at about 90% in the last couple of weeks. That's why it's important that people understand that we're not doing this just for ourselves, but we want to protect our healthcare heroes who truthfully have gone through a lot over the last 2 years and are burning out. We need to protect them by keeping our hospitalization rates low. With that, I'm going to turn it over to our Health Commissioner, Dr. Burstein, so that she can talk a little bit more about what's going on in Erie County. Thank you.
Thank you, County Executive. So let me share with you what we're seeing in Erie County just in terms of COVID-19. So as you all know, Erie County is experiencing an acceleration of new daily COVID-19 cases and weekly case totals that we haven't seen since the peak of the previous COVID-19 wave. Our total of 714 cases in one day on November 12th was extreme and speaks to a general widespread community transmission happening right now. Our regional positivity rate, and that's the proportion of COVID-19 tests that were positive each day, is up there with the Finger Lakes, and our friends in Monroe County have the highest in the state right now. We know from experience what follows high numbers of new cases. Increases in hospitalizations, and very sadly, some of these people will die, and we'll see additional COVID-19 associated deaths. Within Erie County, there are people who are very vulnerable to moderate and severe illness if they were exposed to COVID-19. So we all know these people. They're older adults, people with immunocompromising conditions, including taking medications, and pregnant women and new moms. So that's we are strongly encouraging people who are eligible for booster doses or third doses of COVID-19 vaccine to go to get that additional dose for that additional needed protection. We hear a lot that COVID-19 doesn't affect kids that much. And from what we know now, although most children are less likely to develop severe illness, they are all likely to transmit infection to other people in their house or who are close to them. Remember, even though children may not feel ill with COVID-19 infection, they are still little infectious disease vectors and transmit infections to others around them, just like they do with every other single respiratory illness. And I can tell you that among our children in Erie County, it's the 45% that are not fully vaccinated that contribute to 85% of infections among children 0 to 17 years. So children who are vaccinated are protected. And now we have the opportunity to get those kids 5 to 11-year-olds protected. And our CMOs here today can tell you that they have seen severe COVID-19 cases in children, and that household transmission can increase the risk of very poor outcomes for older adults in the family. And my pediatric colleagues in the community have told me that they've seen long hauler cases among their pediatric patients who are affected for months. So although also in Erie, the Erie County Department of Health, pediatricians and pharmacies have been vaccinating the 5 to 11-year-old population over the past week and a half, it will be months before we have good coverage and full vaccination for this group. So I understand pandemic fatigue is real. I'm feeling it too, and it's intense. We are living through another holiday season in the shadow of this pandemic, but with one significant change. Now we have a safe and effective vaccine to protect us all. So going into this winter, we know we have tools to protect our community, and they are very basic that we've been doing for a long time. Vaccinate, wear a mask, stay home and away from others, and if you are sick, and test. Testing is still a vital tool. With the wide availability of COVID-19 laboratory PCRs and home tests, it's easy to test yourself and your family members. So if you choose a home test, please take that test at least twice during over 2 or 3 days before you go out to a holiday gathering or family get together or any type of party, just to ensure that no infection is missed, because these home tests are not as sensitive as a laboratory-based PCR test that we get. So before I turn it over to my friend and colleague, Dr. Mendoza from Monroe County, I'd like to invite the chief medical officers and other physician leaders in our community who are on this call to share briefly comments. So again, I'll introduce, we have Dr. Hans Kazigno, the executive vice president and chief physician executive at Catholic Health. Dr. Mike Mineo, the Chief Medical Officer of Buffalo General Hospital and Millard Fillmore Suburban Hospital and the Kaleida Healthcare System. Dr. Brian Murray, the Chief Medical Officer of Erie County Medical Center, and Dr. Steve Turkovich, the Vice President and Chief Medical Officer of John Oshai Children's Hospital. So I just like to open it up to any of my Chief Medical Officer colleagues to speak.
Hi, this is Dr. Mike.
Can you hear me?
Hi, this is Dr. Mike Mineo from Buffalo General Medical Center and Millard Fillmore Suburban. Right now, we have 505 inpatients in a hospital built for 456 patients. We're at 110% capacity. Of that, about 10% of them is COVID positive. The message can't be stressed enough to protect yourself, protect your family, because our systems are strained. As Mr. Polankars said, our staff is exhausted. Please do everything we can to protect ourselves. The system just can't handle anymore.
And I also second that. Thank you again, Executive Polankar and Dr. Birdsey, to actually invite us representing the Catholic Health System. Over the past few weeks or so, to say the numbers have been increased drastically is actually an understatement. And the vast majority of those numbers are actually the unvaccinated by far. We're seeing numbers that are similar to last November. The number of newly diagnosed cases that we see as a system is as high as it was in April. And I believe Executive Polankar actually mentioned that also. The unvaccinated seems to be approximately 15 to 20 years younger in our health system than it is compared to the vaccinated. And to add to that, when you compare the unvaccinated, the amount of immunosuppressive medical condition they have is far greater compared to the vaccinated population as a whole. So to say it in another word, the older population, usually that we're seeing with COVID-19, actually is vaccinated with more complexities, but yet the unvaccinated population is far younger with very few medical complication as a whole. If there's one thing that we really want to force is really re-stress the message that we're talking about, which is vaccination save lives. Vaccination is key. Social distancing is still a key for us, unfortunately, because there's such a significant amount of our population is still unvaccinated. Until we hit herd immunity, it's still going to be key for us as a whole. And last but not least, we have to be pushing boosters also. So many of us, including myself, have gotten my booster because I've been greater than 6 months or more since the first series of the dose. At the end of the day, the one thing that we want to do consistently is really to remind our population at large, there's very good reason to get vaccinated. The very first one is really for your loved ones. There's no better way for you to protect your loved ones against COVID-19 is by getting vaccinated. And by our loved ones, usually most people think about their children. Dr. Bernstein just mentioned that the vast majority of children that are getting COVID-19 are unvaccinated. Please do protect yourself. You don't want to be a vector for them. Our elderly fall into that same category. And last but not least, one of the things that I usually don't push, but I think for our populace, we really need to make sure we stress that if we want to go back to life, whatever it was before COVID-19, all of us need to get vaccinated if we're actually able to get vaccinated. So we really need to do it for our community at large. And last but not least, our economy has suffered from this enormously. So until most of us get vaccinated, our economy will continue to suffer. And I'll actually close by saying thank you again for giving me the opportunity to be in this forum, and really vaccination save lives. Thank you, Dr. Bernstein, and thank you, Executive Polankars.
The situation is very similar at ECMC, at the risk of sounding like a broken record. Obviously, every staffed bed we have in the hospital is occupied. And in addition, we have any given day, 30 patients backed up in our emergency room, waiting for beds in the hospital. What's happening in terms of the increase in cases is eerily similar to what we experienced last November, except we, as Mike pointed out earlier, we are not in a good shape to handle such a surge. Our hospitals are overstressed. We've had attrition of staff through burnout and so forth. So you really don't want to be getting sick and being hospitalized with this, because 1 in 10 of the patients that are hospitalized with COVID expire in the hospital. So all I can do is endorse everything that's being said. And I had the interesting experience of being in New York City a couple of weeks ago. That is the only area in the country that's or in the state that's continuing to experience a decrease in cases. I was impressed with people's adherence, the high vaccination rate, people's adherence to social distancing and mask wearing. And I can say it was the first time I felt safer in New York City than in Buffalo.
Hi, this is Dr. Turkovich, the Oshai Children's Hospital Chief Medical Officer. I do want to echo some of the things that Gail has said about the pediatric perspective. As we know, the most important thing we can do to protect ourselves, our community, and those who are less than 5 and not eligible to be vaccinated is to please get vaccinated. We're starting to see a younger population of children admitted to the hospital with COVID. To put that in perspective, since November 1st, we've had 10 children admitted to the hospital. 7 of them are less than 5 years old. And all of them contracted COVID from a family member who was positive with COVID, who was unvaccinated, whether that be a parent or an older child. We're also starting to see an increasing number of children admitted to the pediatric ICU with COVID. Thus far this month, we've had 5 admitted. Last month, we had a total of 5. So unfortunately, that rate is going up. And to put this in perspective for the pandemic, we've had almost 200 children admitted to the hospital with COVID since March of 2020. And we've had over 50 of them requiring the pediatric intensive care unit. So although most children have a very mild illness, there is a good number of them that will go on to develop a severe enough illness to be hospitalized. And as Dr. Bernstein said, upwards of 10% or more of children who have COVID, many of them who have mild or even asymptomatic infection initially, may go on to develop long COVID syndrome. So it's really important to please, please, please get vaccinated. Get your booster if you're eligible. It's so important to do it today because as we enter into the holidays, we are going to be potentially exposing others who are immunocompromised or others who don't have a very good response to the vaccine. So the most important thing we can do to keep our community safe, ourselves safe, and also keep our kids in school. Once your children are fully vaccinated, if they are asymptomatic and exposed to a person with COVID, they no longer need to quarantine. That was one of the major reasons why I personally got my 2 boys vaccinated the day it became available. Please don't wait. Please get vaccinated.
Thank you. And thank you to my hospital colleagues. So now I'm going to turn the baton over to Dr. Michael Mendoza from the Monroe County Health Department, my commissioner and colleague and friend, and the Monroe County Chief Medical Officers.
Thank you, Dr. Bernstein, and good afternoon to members of the media joining us here today. Since March of last year, communities across upstate New York have been grappling with an unprecedented public health challenge. COVID-19 has affected every aspect of our lives, and it has taken many lives. The vast majority of us did the right things, and we based our decisions on science, facts, and truth. We hunkered down, we wore masks, and we practiced social distancing. and we got vaccinated to the tune of more than 700,000 people in the Finger Lakes region alone and counting. So we are left wondering why. Why today are we still seeing case numbers that are rising? We are left wondering if the things we did mattered. Well, I'm here to tell you without question, our efforts did matter, and they still matter. It is very difficult, if not impossible, to quantify the outcome of prevention efforts. We cannot yet come up with the exact number of cases that were averted by a mask. We cannot count the precise number of serious illnesses that did not occur due to a vaccine. And we cannot know if the loved one sitting across from us at the dinner table tonight might not be there tonight were it not for the collective efforts that we made to battle this virus. But I have no doubt that we would be facing a much greater hardship today were it not for the sacrifices and the responsible actions that we all took to protect ourselves, to protect our loved ones, and to protect our community. Above all else, I want to thank you all for making the difference that you have made. I also have to ask you not to let down your guard yet. Even with the vast majority of eligible adults vaccinated in our community, we are still seeing a surge in cases among both the unvaccinated and the vaccinated. We have more daily cases today than 1 year ago. But I want to caution you not to assume that cases are all that matter. In fact, a case last year when we had no vaccine means something very different than now when we have a highly effective vaccine. 2021 is a new stage of the pandemic. And as we look ahead to when COVID becomes endemic, we need to keep our focus on preventing serious illness and death. That starts with preventing cases, but it does not stop there. We also need to prevent hospitalizations. And unfortunately, we are experiencing a related and concerning increase in the hospitalization rate, especially among unvaccinated individuals. We can trace this to several factors. Last year, the Delta variant had not made its way to our region. This variant has proven to be much more opportunistic, and it spreads much more easily whenever the opportunity presents itself. We let our guard down, giving it that opportunity. We got tired of wearing masks in public spaces, and we got tired of limiting our gatherings. Some of us decided if enough other people got vaccinated, we didn't have to do the same. We let our guard down too soon. And although the vaccines remain just as good at preventing serious illness and hospitalization, they are slowly losing their effectiveness at preventing cases that might or might not cause serious illness, cases that might or might not be spread to someone else who is more vulnerable. This is not a surprise. It was expected. We just did not know the timetable. But the time to get your booster shot is here or fast approaching. So this combination of factors, the Delta variant, letting our guard down too quickly, and the decline in vaccine efficacy has led us to this point in the pandemic. We are at a place where we need to make conscious decisions based on the science available to us today. We do not need to shut everything down, but we do need to wear our masks when we might be at risk or putting others at risk of contracting the virus. We do need to consider where we gather, who we are gathering with, and the size of our gatherings. We do need to recognize the unquestionable value of vaccination and its proven ability to protect us from hospitalization or death. And we do need to remember that we have the power to change, to take charge of our health. We do have the power to control the virus rather than to let it to control us. Now, as we prepare to celebrate Thanksgiving, I want to express my gratitude for all that we have accomplished together during the course of this pandemic. And I sincerely and respectfully ask you to join me and the others on this panel as we collectively move forward, armed with all of the knowledge that we have gained to date. Thank you. And now I want to introduce my colleagues from here in Rochester, Chief Medical Officer, Dr. Michael Apostolakis from UR Medicine, and Chief Medical Officer, Dr. Robert Mayo from Rochester Regional Health.
Thank you, Dr. Mendoza. I just have a few brief comments. I want to echo the effectiveness and safety of our vaccines for COVID-19. Not only am I CMO for the University of Rochester Medical Center, but I'm an intensivist, and I have the privilege this week of being the attending on our COVID ICU. Despite over 70% of our adult population being vaccinated for COVID-19, over 80% of the patients in our ICU who have COVID are not vaccinated. The not vaccinated patients in our ICU with COVID are younger, generally in their 50s, as opposed to the few vaccinated patients in our ICU who are usually 75 or older. The vaccination is protective, and it prevents severe illness. If you're thinking about getting vaccinated, please do. I talk with patients, those who can talk to me, and family members who didn't realize how sick they could become with COVID despite not having comorbidity. And they wish they had to make the choice over again because they would have made a different choice. Our ICUs are stressed, our hospitals are stressed, and vaccination of the rest of our population could help with that. And not only am I talking about COVID illness, what I'm concerned about is beds being utilized for preventable disease that we could use for non-COVID illness. And I'm concerned about harm that could occur if we don't stem the tide here with patients with non-COVID illness. So please protect yourself, protect your families, protect your communities, and protect your healthcare heroes who are doing everything they can every day to help our community and help save lives. So thank you.
Good afternoon. I'm Rob Mayo, the Chief Medical Officer of Rochester Regional Health, and I'm pleased to join this panel of esteemed medical and governmental colleagues. The voice that you have heard us speak with today is one of unity and one of consistency about the importance of all measures to fight the COVID-19 pandemic. So all that has been said previous to me, I endorse. And I ask the community and all the citizens of our regions to similarly act in unity and in consideration for your neighbors and your family to move forward and fully embrace the vaccination opportunity that we each have to preserve our health and to make a major difference in this pandemic. Thank you.
Okay, very good. I think with that, we're set to move on to some questions. And I think we'll start out with Jeff Preval from WGRZ, followed by Raquel Stephen from WXXI. Go ahead, Jeff.
Thank you. A question for County Executive Mark Polankars and Dr. Burstein. We've seen a couple of school districts in Western New York, at least on a temporary basis, go to virtual learning. And I wonder whether you think that that's something that should be more widespread across Western New York. And at what point do you think that a full virtual learning model should be implemented, if at all?
Jeff, before Dr. Burstein goes, I'll just say we're not at a point where we need to have a full virtual learning model. But this is why we're meeting together today through Zoom, is to get the message out to the public that there unfortunately have been cases that are recorded among those in schools, students and faculty. And we do know of a number of classrooms that are going virtually because of multiple cases in those classrooms. We're trying to sort of, as they used to say, nip it in the bud, get to a point where we are not having to even discuss going virtual for entire districts. We are concerned though, because we have seen a rapid rise of cases in all age groups. And it is impacting schools just like it's impacting employers. I'm hearing from employers that they're losing employees due to illness. So our goal is to try to get to a point where we got enough advance notice to the public that we don't have to consider going virtual for a whole district because of what would be considered even a much worse rise in cases and hospitalizations. As I said earlier, this is in some ways a call of action to our community in Western New York and the Finger Lakes regions to protect each other, to be our brothers and sisters keeper, so we do not have to implement mandates or other types of requirements. But we are seeing cases in the schools, and I'll turn over to Dr. Burstein because we have a specific team that works through the Erie County Department of Health that is solely dedicated to addressing school COVID issues, and Dr. Burstein can speak more about it, but there has been an increase, and as a result, we have seen some classrooms go virtual because of it.
Thank you, County Executive. So as we always say in public health is local. So we've been working with the schools to make sure that everybody in the schools stays safe. And if individual schools or if classrooms in individual schools do see outbreaks, we work with those schools and advise them of next course. However, again, as I said earlier, we see that the 45% of unvaccinated children account for 85% of COVID-19 cases. So if we can get as many kids vaccinated who are school age as possible, and staff, it's important that school staff get vaccinated too, then we will see a decline in case numbers. So we all have to work together. The schools are being very cooperative, making sure that their students are social distance as much as possible, masking, and all that helps. But it's up to our individual parents to make sure that their kids get vaccinated. You know, another challenge is not just in the classroom, it's outside the classroom. So buses are a challenge, and it's important that parents advise their kids to remain in one seat and don't run around and socialize in the bus, and make sure that they keep their mask on. And also sports. And again, it's important that when kids are playing those extracurricular sports or any extracurricular activities, it's still really important to continue with masking and distancing as much as possible. And again, if anybody feels sick, please get a test. We have so many tests here in Erie County that are available. Please get tested. And doing all those things together, working together, we want to keep schools open, and we can keep schools open. We all have to make an effort to make that happen. Thank you.
Okay, very good. Next question is from Raquel Stephen with WXXI, and following her will be Eileen Buckley from WKBW.
Yes, thank you. My question for Dr. Mendoza and County Executive Bello. I know we're not looking to implement any mandates or shutdowns, but why not implement this if they've been proven effective in the past? And under what conditions will you consider implementing a mandate or shutting down?
Right. So right now, today, we're looking to raise awareness right now in the community and raise an alarm. The numbers are going up. We're starting to see that exponential rise day over day. So this is a call to action by the community. We're going to start there. Nobody wants to go back to what we saw last year, where we had mandates imposed, businesses shutting down. I'll send you back in time to the yellow zone, orange zone, red zones, and people were out of work, schools were closing. We cannot get back to that time. So this is a call to action of the community. We know what works. It's common sense. It's getting the vaccine. It's wearing a mask. It's socially distancing. It's staying home when you're sick. So we're going to start with that and remind the community. Now is the time to double down, is to dig deep in understanding how do we protect each other, how we protect the community. And it can't just be a personal, selfish response. We all have a responsibility to the community, to the people around us. It's been said before by another speaker, I think it was Dr. Burstein, who said this. We have to keep the schools open. This goes back to something Dr. Mendoza and I have been saying from the very beginning. We've got to keep the schools open. We've got to keep the economy running. Right now, we believe this is the most effective measure. We want to call to action. We will monitor the situation over the coming days. But this is a really good opportunity to remind everybody, this is what works. This is what flattened the curve last time. I believe that this community is up for it, whether in Buffalo or here in Rochester. We've done it before. We're going to do it again. I believe and have faith in everyone who's watching this, but we got to get back to the basics, which is really just common sense.
Yeah, I agree with the county executive. We should not need mandates. If everybody did what we're recommending here today, we should not need mandates. We've done this before. We've demonstrated that we can do it again. That being said, everything's on the table, and we certainly don't want to go down the route of mandates, and I don't think that should be necessary. But we do need to follow the data and see where the numbers go, because at the end of the day, we cannot allow this pandemic to wreak havoc on our society, whether it's through mandates or through health-related reasons. We want to take the path of health and safety, and I think if we take these reasonable common sense steps, I think that's the way we'll go.
Okay, our next question comes from Eileen Buckley with WKBW, followed by Allie Peters with WROC.
Thank you so much. And similar question to the Erie County leadership on mandates. Would you at least consider going back to a mask mandate for at least going to grocery stores or some of the businesses again? Because it seems like there is no really honor system happening right now.
Well, Eileen, as County Executive Bello stated, we're going to watch this closely. We have a mask mandate in Erie County government for all Erie County government buildings. And we know it works because while we have had some employees who've tested positive recently, our contact tracers have basically been able to determine they caught it outside of county government. So we're asking the public, we're asking private entities to consider it doing themselves. But I think I have a reputation that I'm not afraid to take the action if necessary, much to my detriment. Last Thanksgiving, I had protesters in front of my house. If I have protesters in front of my house again this year, I'll deal with it. But I'm willing to do what's necessary to protect the overall general public. So this is, we know there's a call to action. If we see these numbers continue to rise and we're seeing what would be considered lack of fellow patriotism and fellow belief in our neighbors by people not wearing masks, then it's an action I'm willing to take. But before we do that, I want to give the public an opportunity to show that they do care about each other. And we're there, as I said earlier, to be our brothers and sisters keeper. And if we have to take the action, we will. We are entering a period in which we expected the numbers to go up, but we didn't expect it to go up as rapidly as it did. People are inside, it's colder, and the holidays are coming. We're just asking people to use common sense, wear a mask when appropriate, be vaccinated. If you haven't been vaccinated, get a booster if you qualify. And really important, if you're sick, get tested. Don't go to work. Don't send your children to school if they're sick. Have them tested so that they are not spreading COVID to other people who you yourself may not get a serious illness, but you may pass it on to someone else who could. And we're just asking everyone to come together as a community. I said this early on in the pandemic. I hearken back to the stories my grandfather used to tell me about how the nation came together and put up with a lot of what would be considered restrictions for World War II. And that was a 3.5-year period. And I know people are over it, but we're not over the pandemic itself. And we need to have that type of attitude of coming together for our fellow man, our fellow woman, so that we can all get through this. And that's what I'm asking the public to do now, because I really don't want to implement those mandates, but I will. And as a reminder, the state of emergency is still in effect in Erie County. We've been having it in effect for a while to help us with delivering vaccines. But if I have to implement additional mandates and restrictions, I will, and I will use the powers delegated to me by New York State under the state of emergency power to do it. So let's avoid that situation by doing what's right for all now.
Thanks. And Eileen, if I could just add that, we're finding from our contact tracers, many people who are newly diagnosed with COVID-19 believe that they were exposed at a social gathering. So they were at a party or they were out in a bar with some friends. And so, those we can't really prevent by mandating masks in public places like stores and restaurants when people aren't seated. So it's really important that people take control of their situation, make sure that they keep their parties small, make sure that people who are congregating know their status. Again, we have a lot of PCR testing available in the community. There are a lot of home tests that people can use and test themselves for twice for about 2 or 3 days, before they go out, but really know your status and then stay away from others if you're sick. So again, a mask mandate will help. However, where people are getting infected, the mask mandate may not touch them. So we all have to take responsibility, and that includes getting vaccinated and continuing to continuing to engage in all these preventive behaviors. And I know people are tired. I know people are sick of it. I'm sick of it too. However, I'd rather be sick of it than dead or see my loved ones dead. So, I mean, this is a life or death situation. Thank you.
Great. Our next question will be from Allie Peters with WROC, followed by Chris Forvatis with WIVB.
Good afternoon. This question is for Monroe County health leaders. Just curious, with the holidays coming up and cases and hospitalizations rising, what is your recommendation for family or social gatherings, even if people are vaccinated? Is there concern about breakthrough cases? Do you recommend wearing a mask even if you're vaccinated, et cetera? If you could just touch on that, that'd be great.
So here in Monroe County, about 30% of our daily cases are among people who are vaccinated. Those are just cases. Those aren't necessarily people who are ending up in the hospital. But these people who had already gotten their vaccine didn't expect to be positive, and they were. And the reality is that none of us can know if we're in that 30% or not, if we end up becoming infected, even though we had our vaccine. So obviously you can't wear a mask when you're eating or drinking, but if you're in a company, particularly a larger company, a company whose status you may not know, the odds of being among somebody who might have an asymptomatic infection that could be spread to you simply grows. So I would advise that everybody take all appropriate cautions when indoors, especially. The larger the gathering, the more unknown the gathering is in terms of who's there, and make the choice based on your own tolerance for risk and your desire to be safe and healthy. The reality is that we're entering again a very uncertain period in this pandemic. And for me, I would rather not take any unnecessary chances personally.
Sorry, and I would like to, and I'll just say, I think that's right. And I'll just add this too. There are things that you can do personally to help mitigate then your risk. And it's not too late to do that. Number one is to take a test, right? Test as you lead up into Thanksgiving and to all the holidays coming up, so you understand and you know your personal situation. Please stay home if you're not feeling well. If you have any of the symptoms of COVID-19, please stay home, seek out a test. And then number three is get the booster shot if you're eligible for a booster. That's something that everyone can do today and will help protect you in the upcoming holiday season.
Great. Next up is Chris Horvatis, and then followed by Jen Lukey with WHEC.
Thank you. For the two executives on the call, should we surmise with you holding this joint briefing that should things go downhill and mandates become necessary, that they be implemented kind of on a joint basis between the two counties as well?
I'll take it first, Chris. I wouldn't say you should surmise that to be the case. Adam and I have been on the phone a lot over the last 19 months talking about issues in our region. And as I noted earlier, this is not just an issue with regards to Erie and Monroe County. This is an issue with regards to the entire regions. And some of the highest rates are actually in the counties that are between us: Orleans, Genesee, Wyoming. So we're concerned about the entire region. You certainly have to take it on a case-by-case basis, but we know COVID-19 does not observe the lines that are drawn on a map for municipalities, and there's a lot of cross traffic between Erie and Monroe County. We know a lot of folks from Monroe County want to go to our Bills games, and if they're going, they're vaccinated now. A lot of folks that visit family and loved ones from the Buffalo area and Rochester. So we're just asking everyone to act appropriately. It's not necessarily that if I have to institute a mandate here that County Executive Bello would do the same, because I think it's going to be based on the circumstances associated with each community, as compared to say, we'll do it together because we want to send a joint message out. It really is going to be based on the scientific data that we're getting and the statistics that show what's happening in our communities. But we felt it was very important that we shared this message together, because we are very close in many ways, not just geography, but the numbers and the case increases we've been seeing, including hospitalizations, were pretty much mirroring themselves between our two communities. So we needed to get this message out together.
That's exactly right. And Chris, it's actually nice to hear your voice. We lost you a little while ago there in Buffalo. But that's exactly right. I mean, right now, our communities are looking very similar in how our numbers are trending up, what we're seeing in the hospitals. And there is a lot of back and forth between Erie and Monroe County. This is also an area that's in the state where we are seeing something relatively unique to other areas. If you go back downstate, you're starting to see a lot of their numbers fall. Their vaccination rates are higher. And so we're very much in the same boat right now. Does that continue? I don't know. But what I do know is that in our conversations, the mitigation strategies that we want to give to our communities is the same. We really are asking people to please get vaccinated. Please get the booster shot. If you're feeling sick, please stay home. But also we need to get back to the basics. One of the questions earlier was talking about masking. And, one thing that worked well, we didn't have to mandate masks for a lot of the folks in the community participate in masking, and we brought our numbers way down. I believe we can do that again. We just have to start that conversation again. We have to understand what the numbers look like, and we have to communicate that. And that's what we're doing today. But I have faith that people are going to follow these recommendations.
Okay, very good. Thank you, Chris. Our next question will be from Jen Lukey with WHEC, followed by Michael Mroziak with WBFF.
Hi, good afternoon, everyone. I have a question for Dr. Apostolakis and Dr. Mayo, specifically about hospital capacity. As you know, we've been doing a lot of reporting on that the last several weeks. We've heard some of the Buffalo counterparts talk about being at 110% capacity. I'm wondering what you're seeing again locally. And I know, Dr. Apostolakis, you touched on this briefly about the overwhelming sort of crush of patients, but at what point does this become something that needs more, or something that we've already seen you open up space where space normally isn't for beds, and in trying to work on this overwhelming number of patients. But with this increase in COVID, how are we at a crisis level?
Great question, Jennifer. And no, we're not at a crisis level yet. And I believe that's the reason we're having this conference. We'd like to prevent that. Right now, we continue to take care of our patients in our community. We have surgeries going on. We're doing transplants. We're caring for urgent and emergent issues. We've continued outpatient elective surgeries, and we have held off on some of our inpatient elective surgeries for people that don't require hospital admission. And so there have been some delays. We meet every day, twice a day, to talk about capacity issues, to talk about staffing, to talk about outpatient and inpatient capacity. We do, as you know, have people waiting in our emergency rooms every day for inpatient beds, but we're able to care for them in the emergency department. If this surge continues and worsens, we are at risk to limit some of the elective things that we're doing. So non-COVID illness will allow to go along untreated. And that's why it's so important, if you haven't been vaccinated, to get vaccinated. The data is absolutely crystal clear. Vaccination is the best way to prevent illness and severe illness and get admitted to the hospital. And that's why I'm pleading for the community. If you're thinking about it and you're on the fence of getting vaccinated, please get vaccinated for yourself, your loved ones, your community, and for your healthcare heroes who are trying to care for the entire community.
Thank you, Dr. Apostolakis, and Jen, for that question. I would say that Rochester Regional Health feels similarly about the overcapacity situation. It is a strain. There's no question about it. Throughout the last 2 years, there have been a number of times where employees within Rochester Regional Health have volunteered to take extra shifts and work in other areas that need help. And I'm very appreciative to the great healthcare workers who step up to that. And that still is happening. We still have folks that don't regularly work in our emergency departments or on our inpatient units who step forward to help those teams out. And so we will continue to encourage healthcare workers to support one another in this way. Thus far, the most common thing that patients have experienced are delays. There have been much longer than desirable waiting times in our emergency departments and some of our other facilities. But because of this shifting of resources to accommodate needs. But we can continue to do that. We have more flexibility to do that. Hopefully we won't reach the time during the peak of the pandemic last year when we actually had to close ambulatory facilities or sites to really move a large number of people. But we will continue to assess that carefully and let the public know what's happening if we do.
Great. Our next question will be from Michael Mroziak with WBFO, followed by Carla Rogner with WHAM.
Thank you for the time and good afternoon, everyone. We're seeing some correspondence here between Monroe and Erie counties. I was just curious to know how the correspondence has been with neighboring counties, Niagara, Orleans. In many cases, people might live in those counties, commute across county lines to work or vice versa. I was just wondering how the correspondence has been with some of the neighbors, and are there numbers there that are cause for concerns within your counties?
Michael, I actually spoke to Chautauqua County Executive PJ Wendell last week. Yeah, he's stressing the same message. It's a little different in some of the other counties because they don't have county executives. They have county legislatures or county managers. I will note Department of Health, Dr. Burstein, they have been in touch with the health departments associated with many of these counties. Dr. Kevin Watkins from Cattaraugus County was actually leading the county health officials statewide. So he's certainly aware of this. As I noted, as we showed earlier in the one slide, the numbers associated with new cases, the positivity rate, the rate per 100,000 residents over a 7-day period is actually higher in much of these rural counties. And that's why this message needs to go out to all of Western New York and the Finger Lakes region. And it's just not the cities that are the problem. We're seeing cases in all aspects of Erie County, just like our friends across the spectrum in Western and in the Finger Lakes region are dealing with. So we are in contact. It's not as easy sometimes to get direct relationships with the leaders in those other counties, but I will say this, we came together last year to protect our public. I know the other leaders feel the same way in the other counties from when I've talked to them in the past. And we just want everybody to know that we're all in this together, whether you live in Erie or Allegheny or Genesee or Livingston or Niagara County or Monroe. We are all part of one family here on the western end of New York State, and working together, we will get through this.
Yeah, County Executive, that's exactly right. I just want to say, we have the same level of collaboration here. We meet the Finger Lakes region county leadership, whether it's county administrator and myself as county executive. We meet every week. We collaborate when it comes to cases, number of strategies, things that are working, not working. One thing that's very important, we just met this morning to talk about purchasing. So we understand, some counties have better luck than others when it comes to purchasing supplies, things like test kits and things of that nature. So that level of collaboration amongst your leadership is critical. That's the type of collaboration County Executive Polankars and I have. We talk all the time because you can't do this by yourself. Everybody's going to have a good idea or not. Everyone's going to have a different challenge that others may have experienced and have a good idea on how to meet that challenge. And we have seen, I think, a great openness to leadership across this region to that level of collaboration.
The health departments have similarly been collaborating. Actually, at 7 o'clock this morning, which is very early for me, we were on a call with all the local health, public health leaders and health commissioners talking about how we're going to conquer the next frontier of COVID-19 prevention, and that's vaccinating the 5 to 11-year-olds. So we are trying to strategize together. We're actually having a collected vaccination clinic with one of our surrounding counties to vaccinate the kids that live on the borders. So we are trying very hard to work together to make sure everybody is safe and protected in this community. Thanks.
Great. Our next question will be from Carla Rogner, and then I have a question on behalf of Brianne Rosser from Spectrum Buffalo.
Hi, I had a question about something I think Mark Polankars brought up earlier about the booster shot. It sounded like you're encouraging everyone to get a booster now, regardless of whether or not they're eligible. And I just wanted to clarify if that was true and if the same goes for Monroe County.
That is true with regards to Erie County. It's more than 6 months since you received the Pfizer and Moderna, and you come to a county clinic, and you can call 716-858-2929 to schedule an appointment. We will give you the booster. Same with if it's been more than 2 months from Johnson & Johnson. We have been doing that. We are turning no one away unless it's a time constraint where they maybe they finished their initial vaccine regimen 3 months ago and they should be waiting 6. So in Erie County, we've made that decision and we're going forward with that.
So in Monroe County, we put the eligibilities on our website. It's the same in terms of the time period. We ask that you self-attest to the eligibility criteria related to your work conditions, whether or not you're in a high risk environment or not. But we ask you to self-assess to your own risk and whether or not you qualify for that booster dose. And it's not strictly limited to just the list of professions that were out there that were given as examples, but it's up to you to make that decision whether or not you're at that higher risk.
Just want to point out that in both of our counties, we have so much vaccine. We have such a great supply. And Tony Fauci, our great public health leader, is always telling us that these mRNA vaccines should have been a 3-dose series rather than a 2-dose series. And Johnson & Johnson should have been a 2-dose series rather than a 1-dose series. And even among people that aren't officially eligible, we know it still will help protect them against disease. And right now, the FDA is reviewing data to authorize for emergency use of the booster dose for everybody who are 18 and up and meet the time criteria. So, we want everybody to be as safe as possible. And if people think that getting the booster dose, regardless if they fit in those categories or not, will help them keep safe and help their family keep safe and friends, we want to support that effort.
Okay, great, thank you. Next up, on behalf of Brianne Rosser from Spectrum Buffalo, I have a question for County Executive Polankars or Dr. Burstein. And that question is, what are we seeing happening with vaccination rates? Have they stalled? And are people lining up to get their first doses?
I'll take it first and then turning it over to Dr. Burstein. We have seen an increase in vaccinations primarily due to the 5 to 11-year-old age category, but I can give you some numbers just to give you an example. On November 2nd, there were 620,777 Erie County residents that had at least 1 dose. On the 14th, it was 631,777, so it went up by over 11,000. During that same period, we went from 576,116 completing the regimen to 581,423 completing the regimen. So basically about 5,000. So we saw at least 5,000 more people who had not been vaccinated receive at least the first dose in what was basically a 12-day period. So yes, we have seen an increase. We've seen an increase of children in the 5 to 11 age category, but we are concerned about those who are older who have not gotten vaccinated. While we've done a very good job of vaccinating our senior age population, there are still individuals in their 20s and 30s who have not been vaccinated, 40s and 50s for that matter, who are at risk of catching it and potentially having a serious illness. So we want everyone to understand that this is everyone who has to play a role. And I'll turn it over to Dr. Burstein to finish up.
Thank you. So the boosters have been popular since November 8th. There have been about 700 Erie County residents who have been vaccinated with a booster dose. And there have been 450 5 to 11-year-olds that have been vaccinated with their first dose of Pfizer. However, we're seeing very few people who are coming in for their first dose or their second dose. So we really still need to get everybody on board. And even though we have seen some more uptick among people seeking boosters and the 5 to 11-year-old children, that's still just like a small sliver of all the Erie County residents who are eligible for those doses. So we want to give more. We have so much vaccine in our community. Just want to encourage people, just this should be your Thanksgiving gift to yourself. Get a vaccine for yourself and get a vaccine if you're eligible for a booster, or first, second dose, third dose, and get a vaccine for your children. We can all be fully vaccinated and to give thanks for being well and safe on the Thanksgiving holiday.
Thank you so much. Our next question will be from Kelly Holland with Fox Buffalo, and then we'll be followed by Tom Puckett with WBEN.
Hi, this is for anybody in Erie County that wants to chime in regarding our hospitals. What steps are being taken right now to help with any possible staffing issues that this next surge could cause? And what message do you have for anybody that is sick and thinks that they need to head right to a local ER?
I would turn it over to the hospital CMOs to best answer that question. So to each, if you want to get that, go.
I'll take a shot at it, and please, in your mother, other my colleagues could jump right in. I think there's two things. Everybody kind of actually made a suggestion or comment throughout both counties in terms of how much of an issue it is to actually staff our hospitals. And the funny thing is, before COVID-19 hit the US, we actually had an issue already with staffing as a whole throughout the country. It was really the pandemic that was waiting to hit the healthcare system in the United States. COVID-19 just really incredibly sped up that process. Right now, in terms of the challenges that we have in terms of staffing all our clinics, including the hospital as a whole, is really daunting at some particular section. And the weird thing is that the mostly highly skilled healthcare individuals that we have, the caregivers, are the ones that are the rarest to actually get staffing for. And again, lo and behold, those are the people that really took the brunt of the COVID-19 pandemic the past 18 months or so. It's been well publicized, including with our own healthcare system. Some of the NICU nurses, ICU nurses, ED nurses, almost 10 to 15% of them over the past 18 months or so have actually either entered early retirement or are no longer involved in healthcare. So that's really daunting. So what we're trying to do to address it. So we're actually engaging in several months, and I have to give my leader, CEO Mark Sullivan, some credit for some of the things that we're doing at the least, to say the least. One of the things that really we have a significant issue is not, when I say we, I mean the healthcare industry, not Catholic Health per se. Staffing agencies are really a significant issue for the healthcare industry. And that sounds weird, but they are, because the rate that they're offering compared to someone that's employed is phenomenal. From the economic point of view, it makes no sense for me as an obstetrician and gynecologist to actually work for a healthcare system versus being employed by an agency in comparison in terms of if I were to be a nurse in this setting. So that is one of the big challenges that we're trying to address. So internally, we're looking at various options in terms of how do we entice some of those caregivers that actually still want to work in Buffalo, but they don't want to work at Kaleida, they don't want to work at ECMC, they don't want to work at Catholic Health, they want to work for an agency because the return on investment for that time is so much higher compared to any of us could offer them. That's one of the things we're trying to address. The other thing is the key thing that keep popping up, especially with any issue, is burnout in healthcare. COVID-19 has significantly taken a toll on all of us. And caregiver burnout is at the highest it's ever been. So we're trying to look at different ways really to engage all our caregivers, give them a forum to actually really release those stress and actually see work in a different light, not necessarily a place to get burned out, but a place possibly to bring joy back in their life. Because most of us, if not all of us, went into healthcare because we really wanted to make a difference. Not only that, it gave us self-fulfillment to actually help our common and fellow man. And unfortunately, over the past 18 months or so, even though that joy was there, it's been literally trampled on for the amount of hours, the amount of difficulties that we've had to do as healthcare givers. I'll be more than happy if Dr. Murray, Dr. Miller, or Dr. Turkovich would be like to add something, because I know for sure whatever healthcare staffing shortage we're facing at Catholic Health, they have exactly the same issue, because we're in the same market, or we're unfortunately competing for the same resources.
Yeah, this is Dr. Turkovich. I would say that there's three things that we're doing to really help our staffing. The first one is we've talked about getting everybody boosted. It's really important, since healthcare givers were the first in line for the COVID vaccine at the end of 2020 and beginning of this year, that they've gone beyond their 6 months. So we're offering booster shots to all employees to keep them healthy, and also offering the flu shot at the same time. It's really important with the upcoming flu season that we're protecting people, not only from COVID, but also the flu. Secondly, we're providing financial incentives for people to pick up additional shifts so that they can provide some additional time to us and our patients. And thirdly, we are engaging with those travel agencies to supplement the staff that we do have. But as Hans said, staffing has been a significant challenge. We've been looking at all the different levers that we have in order to really keep our staff healthy, both from a physical and a mental health perspective, given the challenges that they've had, and also supplement them with additional staff, as he said as well.
Yeah, our experience has been similar, though actually we have hired over 200 new staff over the past 3 months, but there are particular areas that are a challenge. And actually one of them is personal care aides, because actually many of the colleges are not turning out students at this time. And also there's great competition because of the level of pay of those individuals from other industries that are recruiting. So in that way, we've been able to continue to staff all our services without necessarily having to cut back on other services, but our ability to do so, particularly if there's a major surge here, is going to be severely compromised.
Dr. Burstein, County Executive Polankars, and other elected officials have also helped us by helping expand our base of employees. They've worked to change some of the regulatory requirements, so we can now have EMTs working in the emergency room, which has been a great help to our emergency department nursing staff. We've worked to be able to place patients into post-acute care without clearance from insurance companies, which has been really helpful. So there's lots of different solutions. We're trying to pull every lever possible, recognizing we have a very tired workforce that we can only incentivize so much.
Okay, great. Our next question will be from Tom Puckett with WBEN. And I believe our final question after that will be from Caitlin Dewey with the Buffalo News. Tom, are you here? And perhaps we'll move on to Caitlin Dewey. She doesn't seem to be coming up either. So I think we are done with our questions.
All right, so let me close here, and then I can turn over to my colleague in Erie County. But let me just start by thanking all the health professionals who joined us today for this collaboration across our regions, both here in Monroe County and Erie County. The challenges we're facing today are not unique to either one of our counties, but to our region. But it's also not something we haven't seen before. While we're at a serious situation right now with our rise in numbers and our hospitalizations and what our healthcare system is facing, it's also not a situation that's foreign to us. It's something that we know what to do. We've done it before. and we can do it again. And this time we can do it with a tool that we didn't have in our toolbox earlier this year, and that's with the vaccine. So if you've been hesitant to get a vaccine, if you've been wondering whether or not it's the right thing for you and for your family, now is the time to get those answers, and now is the time to seek medical advice, because we need to get our vaccination numbers up, and it's across the region. By doing that, we're going to be able to come out of this pandemic as a stronger community than when we went into it. There's very simple common sense measures that we can all be taking. We'll go back to what those basics are. It's vaccination, it's booster shots, it's social distancing, and it's wearing a mask when you're in a public setting, and it's also staying home if you're feeling sick. If we can accomplish those things over the next several days, we're going to get through the holiday season healthier and safer. And I'll go back to something I said earlier as well. The vast majority of the people who are going to be sick on Thanksgiving, who are going to be stuck in quarantine, are going to be in isolation. They haven't gotten sick yet. So it's not too late. It's not too late for us to take the measures that are necessary to protect all of our families and protect ourselves, so that we can have the Thanksgiving and the holiday season that we all wanted. So in the spirit of Thanksgiving, I also want to thank our healthcare workers. You guys really are the heroes in this community who've been working around the clock since the beginning of this pandemic. And I know our healthcare workers, they want to be home with their families too this holiday season. And so one way that we can say thank you to them is not necessarily through thank you cards and gift baskets, but we say thank you to our healthcare workers by getting vaccinated and staying healthy so that they can go home and be with their families this holiday season as well. So thank you, County Executive Polankars and your team as well for bringing us together and for doing this today. And I turn it back over to you if you have any closing remarks to make as well. And I appreciate your partnership, friendship, and collaboration as we get through this once in a lifetime pandemic.
Thank you, County Executive Bello, and thank you to your team for hosting today's event. Certainly to Dr. Mendoza and the Chief Medical Officers from the hospitals in the Rochester region, as well as to Dr. Burstein and our Chief Medical Officers here in Erie County. I really appreciate all their participation. It's important that the public heard from us. We hear from the hospitals. We hear from other healthcare providers about what's happening in the community. And we needed to come together as communities to say, we can do better, and we will do better if we follow the advice that was provided by all today. I want to echo your comments and thank all of our healthcare heroes who have worked absolutely incredible hours under exceptionally stressful situations for nearly 2 years now. And we as a community need to step up to the plate to help them so that they can actually enjoy Thanksgiving and enjoy the rest of the holiday season, Hanukkah, Christmas, Kwanzaa, so that they're with their family enjoying the holidays that they enjoy, and they're not having to take care of someone who should not be in the hospital, but is because they were exposed to COVID-19 and may not be vaccinated at this moment. So we just want to say to everyone that in the spirit of coming together, I think we're all Buffalo Bills fans when it comes to supporting our football team. And we all want to be there during the rest of this run for the season, including what is hopefully a great Super Bowl run. But the best way to do that is to have us all healthy and well. So to each and everyone out there, I hope you have a wonderful Thanksgiving, a great holiday season, and most importantly to all, including my colleagues on the call and our friends in the media and those who are watching at home, be safe and well. Take the actions that we're recommending, and we will all get through this together. Thank you.
Thank you.
Executive Polankar, I just want to make a quick comment, and I'm sorry that I have this forum and I didn't even think about it. One of the most vulnerable population that Dr. Turkovich could actually mention is really the pregnancy population as a whole. As an obstetrician and a gynecologist, I just want to reinforce to the entire media and also whoever's listening to us, the pregnancy population is one of the most vulnerable population to COVID-19. If there's a capacity for us to get that population vaccinated, it would save us tremendously, both in terms of maternity morbidity and mortality and neonatal morbidity and mortality. And that is one of the things that is get lost during this whole pandemic, even though that is one of the most horrible losses that we could have as a society in terms of losing a pregnant mother or a newborn child. My apologies for talking right before you were done.
It's an important message to share. So thank you, Dr. Casagnol. And if local media has any additional questions on that, they can reach out to you at Catholic Health. So thank you, and turn it back to you, Dr. Bello, County Executive Bello to close.
All right. Thank you, everybody. I appreciate the media as well for covering this press conference today. Thank you all very much. Happy Thanksgiving.